How you doing? My name is Debbie Cornell, and today I'll be talking to you all about diabetes. My sources are, I got all of this information from a medical surgical book and a basic nursing book, edition 9, nutrition for nursing, and a diabetes website, and the e-medicine website. Alright, first I'm going to tell you what diabetes is. It is specialized cells of the pancreas produce a hormone called insulin to regulate metabolism. Within the hormone, glucose cannot enter the body cells, and blood glucose levels rise. As a result, the individual may begin to experience symptoms of hyperglycemia, which is blood. Simply stated, this is the process called diabetes mellitus. Some signs and symptoms of diabetes mellitus are excessive urination, excessive thirst, and excessive hunger, which are just a few signs of diabetes. There are two types of diabetes, type 1 and type 2. Type 1 is juvenile onset diabetes, and type 2 is adult onset diabetes, which occurs like after 30 years old, and the juvenile diabetes occurs before 30, or when they're born. But today we're going to talk about diabetes 2. Type 2 diabetes occur at any age, but most cases occur after age of 30. More than 80% of clients are overweight. Risk factors for developing type 2 diabetes are heredity, obesity, age, stress, and lack of exercise. Two major factors that can help control prevention of type 2 diabetes is exercise and eating habits. And that is what we're going to talk about today, exercise and eating habits. The general purpose of this is to persuade you all to do better with the exercise and eating habits. First, I want to start off with asking a few questions, which is, how much do you exercise a day? Are your eating habits okay? Do you know if you're at risk for increased type 2 diabetes? If you are puzzled and not satisfied about exercise and eating habits, then maybe it's time for you to change your lifestyle. As a healthcare representative, I would like to encourage you all to exercise and eat healthy and make it a priority. For eating habits and a lack of exercise may link many individuals to diabetes. Furthermore, approximately 23.5 million or 10% of the U.S. population over 20 years of age have diabetes. Central and visceral obesity, weight center around the abdomen, increases the development of diabetes, which is your abdominal girth. When you have a lower area right here, it increases your risk of having diabetes. High caloric intake increases the development of diabetes also. Therefore, I persuade you, you can become a healthy individual and disease-free. You can lose the weight. You can eat a healthy diet. Every time you practice good eating habits and exercise, you decrease your risk of diabetes. Weight reduction, dietary fat reduction, saturated fat reduction, increased dietary fiber, and increased physical activity. All of these guidelines in study have reduced the risk of diabetes by 58%. 5 to 10 minutes of aerobic activity like swimming, walking, dancing, or even non-dairy activities like swimming and bicycling 3 to 5 times a week will also achieve great results. In conclusion, so I persuade you to steer clear of type 2 diabetes with good eating habits and exercise. Be an example and be disease-free. Thank you.